Okay.
Round 3.
New chip. No
This
double
one, Rico Ike Rico. This one is the first one that is marked as hot. So, okay, hopefully your seatbelts.
This is where I might need to break out the
You're not
Pepto-Bismol.
You're not going whiskey either. Not so bad.
I'm nervous though.
Right now.
Sometimes it takes a second.
Question: how can Start Health members get the most out of their HSA?
Sorry, I gotta chew. Hold on. So Start Health members can get the most out of their HSA by making monthly contributions. So your tax contributions or your HSA contributions are tax-free. You can save those dollars for a rainy day instead of using your HSA for all of your medical expenses, saving up to a larger balance for larger medical bills, but then also being able to invest those funds once you reach the dollar threshold. So just to recap, HSA funds are the contributions. Gosh, I feel like you're starting this one over.
Oh, you're okay.
Let's talk through what would be some other things outside of just the regular triple tax.
Let's see. I mean, I would say a great strategy for using your HSA is what a lot of people don't understand is that you can actually reimburse yourself from HSA funds for things that you've already paid for. And so if you can cover the cost of whatever care you receive just out of pocket, I usually recommend that that's what you should do and leave your HSA funds in the account to keep growing in your investments. But if you need to liquidate any of those funds at any time, you can easily just submit a receipt, even for stuff that you care that you received ages ago. As long as your HSA was open at the time of care, it doesn't matter if there was enough money in it at that time. Just as long as it was open, you can reimburse yourself later. And so the strategy is leave as much as you can in there for as long as you can. It will grow in investments. Time value of money, the longer it's in there, the more it will grow. But if you need to liquidate it, it's easy to do so.
One key thing to remember about HSAs is there's no use it or lose it policy, so you don't have to use your funds by the end of the year. You can stockpile them for a rainy day.
Absolutely. Yeah. And just to kind of review, what are the triple tax advantages of HSAs?
Yeah, so HSAs are tax-free contributions, tax-free growth, and tax-free investments. So you pay for care using your HSA, that's tax-free. You make a contribution, that goes in tax-free. And then if you want to invest your HSA funds, that will also grow tax-free.
Yep, and I'll also say that any withdrawals that you make for qualified medical expenses are also tax-free. There's no tax penalty for drawing funds out early.
Awesome.
Did you have a question for me?
Yes. Why should you always ask for the cash price?
Because it's cheaper.
How much cheaper?
What we found is that when our members operate through the cash pay model, they're usually able to save about 40 to 60% on their medical expenses. Another thing that a lot of people don't frequently ask about is the prepay discount. And so those usually compound each other, right? So you can say, first of all, I'm paying cash and I'd like to pay ahead. And oftentimes I've seen providers cut their bill in half when you request that.
One common question that we get is, what if I have a large procedure and I'm paying cash? How does that work? I think what people don't recognize is most of the time providers are willing to offer like a 0% cash or a 0% interest payment plan on larger expenses too. So that goes along with the prepay. Yep.
The other thing about Start Health is that we don't require a proof of payment in order to issue a reimbursement. And so if you have some kind of big medical expense come up, you can just say to the provider, I'm intending on paying cash. I just need a week or so to work it out with my insurance company. We can reimburse you as quickly as we can, given we have all the information that we need. Then you can just turn around and pay for that care and still qualify for the discount. If people want to learn more about Start Health or how to save on healthcare expenses, check out starthealth.com or give us a call, 800-894-9454, or email support@starthealth.com.